All right, great. Got a recording. And back to our share. Okay. So this will be recorded and will be posted on our website and on our YouTube channel. So we'll have access to this if people want to go back and take a look at it, or need to kind of jump out for any reason, or know someone that might want to see it at a different point in time. We will record it so that way it is available to people. So welcome, I'm Dr. Ryan McNally. I practice medicine in San Diego. The webinar today, as you can see, is on immunity and the link between COVID-19 and aging. And we're going to, because this is to a broad audience, some with scientific background and others without scientific background, we're going to start with some basics before we get into, so that way we can understand a bit about what the relationship is with COVID-19 and the aging process. And of course, that link, we believe, and I think we can make a pretty convincing argument, is the immune system. All right. There we go. So really quick with disclaimer here, this is not designed to be medical advice. Anybody that's listening to this, you have to take anything that you hear and any sort of context and as information only. This is designed for informational purposes. If there's anything that you want to apply to your own health, you need to seek the advice of a qualified medical provider. That way they can determine with you if it is appropriate for your health. So it's not designed to be medical advice for anybody. And I have no conflicts of interest to report. A little bit about me. I don't want to spend too much time on here, but basically I am the medical director of Aspire Regenerative. I'm a faculty member at the Academy of Integrative Health and Medicine. And the Chief Scientific Officer for the Centers of Innovation Health Technology, which is a nonprofit designed to help deliver scientific developments to community members. My education, undergrad, University of Massachusetts, graduate from Northeastern. My doctorate was at Southwest College, and my residency was at the Yale Griffin Hospital, University of Bridgeport Integrative Program. And a couple of my highlights here, I was a former chief medical officer from Bass University in San Diego. I held a position with the World Food Program and the International Rescue Committee, and I am published in a peer-reviewed journal. All right, so here's why we're here today, is to learn a bit about the immune system. So I want to start off and just have a bit of a conversation about how does the immune system, how does it relate to our daily life, okay? What's its purpose? Why is it here? I think we all have a pretty good idea that it's partly a defense system, but what is the main function of the immune system? Well, if you're going to be a defense system, you need to have the ability to determine self from non-self, right? And so that's kind of, to some degree, why we have the picture over here of this little fox here looking at itself in the reflection, right? You have to be able, now I don't know if this little fox is capable of understanding that that is a reflection of itself, but we do know obviously that human beings can, and there are other animals that can also notice reflections. And so there's the ability of the organism to identify self versus non-self. Well, likewise, your immune system has to be able to do that. Because if the immune system's function is to be the defense system, is to be the army of the body, it has to determine what is self and what is a microbe, an invader, right? Because otherwise you're going to be harming yourself as much as you're harming an invader. And so that is the primary function of the immune system, is to be able to be the defense system, but then able to determine self versus non-self, all right? The primary component that we are all used to is things like colds and flus that we get annually for the most part. And we've all had some sort of infection in the course of our lives. Maybe we've stepped on a nail and had an infection like cellulitis, or had a wound that got infected, and so forth. So we're all familiar with the concept of foreign invaders that are able to get into our system. Another way that we might know a bit about the immune system is with transplants. So we might have somebody who has severe liver disease, and they need a liver transplant. And so with liver transplants, you are taking out the native liver and you are putting in a non-native liver, okay? And so the immune system would detect this non-native liver as foreign and actually would attack it. as a part of that self versus non-self approach. And so that way, the only way we can make transplants actually work effectively is by giving the person who receives a transplant immune suppressing drugs that kind of dampens the effect of the immune system, so that this new liver or new organ can function normally and allow the person to live and thrive. And so that is another way that we might see the immune system play out in kind of our daily lives. We may know somebody that has had a transplant. Let's see. And so you may have never thought about what's the whole purpose of why would a microbe want to invade me or my family members and so forth. Well, microbes at a very basic level aren't that different than us. They're looking for the same basic things. So they're looking for shelter. They're looking for food. They're looking for a place to raise a family, right? So very, very similar. Obviously, the context is very different, but very similar to the kind of things that we look for as human beings. Roof over a house, resources, and the ability to perhaps have a family. And so microbes, unfortunately, look for a host to do this, right? And the host, in the case of something like COVID-19, is us, okay? Same thing for a flu, the host would be us. The only way the virus is able to get into an environment that it likes and to thrive and to reproduce is to find a host to do so. Unfortunately, that process can, be anything from a mild annoyance to us, to anything that, as severe as actually, killing a patient and so forth. And so microbes really only want to invade because they need us as a host in order to thrive, essentially. And that, of course, poses a problem. Let's see. All right, so now we're going to go a little further into the immune system. All right, we've already said that the purpose of the immune system is to be a defense system. And so one of the common questions that we get with the immune system is, okay, well, it's a defense system. It has to determine self from non-self. Does it ever make any mistakes? And the answer is yes, it absolutely does. And we call those, generally speaking, autoimmune diseases, right? And so you might know an autoimmune disease in the context of something like lupus or rheumatoid arthritis or celiac disease. There's lots of autoimmune diseases, but that is an example of when the body's immune system actually makes a mistake and mistakes its native cells. So it can, essentially in the context of rheumatoid arthritis, it will make a mistake with the connective tissue, and it will think it is actually foreign, and it will go and attack it and cause that inflammatory process and that pain and discomfort and the disabling effect over time with rheumatoid arthritis folks. And so that's an example of how mistaken identity can work against us. So the immune system is very powerful, and when it's working for us, it's very it's protective and it's essential to life and health. But it's when it's working against us, it can cause an autoimmune disease. All right, and another example of when the immune system makes mistakes is with allergies, okay? And so some people, allergies come in varying different levels. Some people have, again, minor annoyances with allergies. Other people have very severe allergies. But generally speaking, the immune system is supposed to adapt to the local environment and basically say, okay, if this is the local environment in terms of pollen and things that float through the air and so forth, then I want to know that this is the normal environment and not be reactive to it. And that works in the majority of the cases, but in some cases, the immune system becomes hyper-reactive to something and starts to basically form a response to it, what we would call an allergic response. And again, usually these are fairly minor things like allergies, weeping eyes, itchiness, maybe postnasal drip, things to that nature, but it can be much more severe in certain cases. There we go. A little delay here. All right, and so another important part of understanding a bit about the immune system before we start to talk about aging and how the immune system interplays with COVID-19 and aging is understanding where the immune system is, okay? And so, when we talk about other kind of organ systems, it's pretty easy. Most people understand where the heart and the lungs are and understand where the liver is and so forth, but where is the immune system, right? It's a little less clear to the average person kind of actually where it lies. And so this diagram over here is a nice diagram to kind of outline the important places. Well, most of the immune cells actually come from our bone marrow. So it's that almost it's kind of sponge-like center of our bones, right? And this one is our humerus, but the bone marrow is in most bones in our body and capable of making immune cells from the bone marrow. So that's one of the most important places, okay? Some of the other important places is something, a gland here called the thymus. Now, the thymus may or may not be a familiar organ to people, but essentially the thymus, if you kind of put your hand in the center of your chest and feel your sternum and run it all the way up to the top of the sternum, you're going to feel eventually a little notch where your throat is. And just below that, the flat part of the sternum or top part of the sternum there is actually called the manubrium. Now, the manubrium is basically where the thymus is sitting underneath, and it's kind of sandwiched between the manubrium on top and the heart and the lungs, which are rather large organs underneath. It's kind of sandwiched right in there. And that is a very, very important part of the immune system that we're going to talk a bit about later on. So we definitely want to kind of make a note about that one, know where it sits and so forth. It communicates very closely with the bone marrow. And so the bone marrow will send cells, these early cells out to the thymus to essentially, it's almost like a barrack. So if you're kind of, again, using the military terminology or analogy, you have these recruits that are created from stem cells in the bone marrow, and they are sent to the thymus to become well-trained soldiers, essentially. And without that maturation process that occurs in the thymus, they remain as these kind of early recruit ineffective immune cells. That's how important the thymus is. And of course, we have lots of other pieces. So when you go get your physical exam on an annual basis, right, one of the things that your clinician is going to do is they're going to palpate lymph nodes, right? And they're looking to make sure that there's nothing abnormal and that no lymph node is enlarged for any reason that might be concerning, something like cancer or something like that. But when we have upper respiratory infections, we can sometimes feel that our our lymph nodes get a little bit large, right? And that's by design. So the immune cells or lymph nodes can get a little bit larger when we have an acute infection going on, and that's part of the normal process. And so that's why we palpate lymph nodes generally on the neck, underneath the mandible, underneath your jaw, and so forth, behind the ears. But they're an important part of the storage place for the immune system as well. And if you think about it, where they're located, so the adenoids and tonsils are up here in the top portion of the throat and kind of the bottom portion of the throat. And if you've ever looked in the back of your throat, you can actually see your tonsils on the bottom part here. You can't really see the adenoids, which are up kind of tucked between the throat and the nose, not very visible. Tonsils, however, you can see. These are places where the immune cells are stationed. And it's actually pretty smart because this is one of the entry ports into the body through the mouth. And so you definitely would want to station your army in places where an invader might be coming in. And so that's awfully good design there. Another place that we have the immune cells is in our gut. And so we're in our intestines here. And so we have these Peyer's patches, again, another interface between the outside world and the inside world, a good place to have an army stationed. And then another station here is in the lungs and the bronchus and so forth. And that's another smart place because, again, it's another entry port for microbes into the body. So you want to have immune cells ready. And your lymph nodes and the lymphatic system overall is a place where immune cells can move back and forth, and then they can also travel in your bloodstream. We do get a little bit of information on generally an annual basis about the bone marrow health when we complete a complete blood count on an annual basis. So when you get your annual labs, the complete blood count, or CBC, is a common lab that's run, and it gives us information about red cells and white cells and platelets and so forth. And essentially, if all of those are normal, that gives us a good indication for the most part that the bone marrow health is okay. Because otherwise, if the bone marrow is not functioning normally, we would see abnormalities in the blood counts. All right. And so the next part here is to give you a little bit of an idea about, this is kind of the third phase of basic immunology, so that we have understanding for what this stuff means when we start talking about some of the more advanced topics is what are some of the cells, how do we categorize the immune system, what are some of the cells in the immune system, right? So the concept of innate immunity. So innate immunity is considered the primitive immunity. It's kind of on the simple side. It's extremely important, but it's considered primitive. They consider it primitive because it's something that has been passed down through evolution. So when human beings go back in the evolutionary change to primates, and primates go back to non-primate animals and so forth and so on, down to simple organisms, we have always, or organisms have always dealt with microbes. And so it makes sense that that organisms would have been given some sort of tool system to identify and fight against microbes, so viruses and bacteria, et cetera. And so over time, organisms had seen, as they kind of go through the evolutionary tree, have seen these similar patterns with microbes, these categories of microbes. And essentially, we have passed down this memory, so to speak, the innate immunity, or this system of fighting microbes from organism to organism to organism, from very simple organisms all the way up to complex organisms like human beings. And so that is the basis for our innate immunity. So our innate immunity is very similar to monkeys, for example, and other primates. Primitive, but yet very, very important, and it actually plays a very vital role in the more specific form of immunity that we'll get to in a moment. And some of the examples are macrophages and granulocytes. Right? And here's an adaptive immunity. And so the innate and adaptive immunity interplay together and form an immune response to a foreign invader. And what you're seeing here is actually antibody production. So these little Y things that you're seeing kind of flying in are attaching to a virus and essentially attacking it, right? And so when the antibodies go in and attach to a virus, like you're seeing here, then you'll have the innate system come in with macrophages, which are basically like Pac-Man, and they come in and they can identify this virus with all the antibodies all over it, and they basically go chomp it up. And that's what we're going to show you here in a second. So let's take a look at what that looks like. It's going to have to transition you to the web page here, but we'll get it. Here we go. All right, so I'm going to play about 30 seconds or so. Make it bigger. And what you're going to be looking for is how this macrophage attacks this bacteria down here. So it just kind of engulfs it and kind of dissolves it essentially. Same thing. I'm pausing it because it's really quick, but this is a bacteria, and it's really interesting because this almost looks like a fish swimming after it, trying to eat it. And you watch, it will chase it around here, but this is another white blood cell chasing a bacteria. Chasing it around, finds it, finally gets it, and destroys it. Same thing, finds another one. Here's a group of bacteria that a macrophage is going and basically swarming and engulfing and eating. So it's pretty neat to see the immune system kind of, in live action going after things. It makes it look very alive, in a way that talking about or showing you pictures of it really can't do. So let me get my PowerPoint back up here. Figure out how to share my screen again. There we go. There we go. All right, so we talked about the innate immunity, we talked about macrophages, and a bit about antibodies. So antibodies are one part of the more sophisticated adaptive immunity, but there's other pieces as well. Things like B cells and T cells are probably the most common components or well-known components of the adaptive immunity. There's also B memory cells. So B memory cells are basically when you are exposed to some sort of bug, like say, for example, COVID-19, if your body wants to be able to more effectively fight it off, if it becomes exposed to it again, you're going to have to rely on your B memory cells. It's basically like a footprint of how to deal with this specific virus, and that's really important. Plasma cells create antibodies, and there's the antibodies. So again, just a little bit of terminology, a little bit of basics about the immune system in terms of what's happening and so forth. So this is a complicated picture, not to overwhelm anybody, but basically this is just showing you from the standpoint of the bone marrow. This is the starting point. The hematopoietic stem cells are the starting point. It's the stem cell that gives rise to all of these different cells, like B cells and T cells and macrophages, which are down here, and red blood cells and platelets and so forth. And so the early guys here, these soldiers that have not been well trained yet, are so important. They have to be healthy in order to be able to give rise to well-conditioned, well-trained soldiers to go out and do their job, essentially. All right. So now let's start talking a bit about COVID-19, this very strange phenomenon that we are all experiencing right now. And so as you can see, this cuddly little creature over here, this is about the cutest picture I could find of a bat. Bats are not necessarily known to be warm and cuddly, but I thought this one was kind of cute. He's eating, I believe, a grape over here or something like that. And so we think that the viral origin is actually from bats, right? And there's been a lot of conspiracy theories out there and so forth, which, are most undoubtedly false, like most conspiracy theories. We have to follow the cookie crumbs when we're looking at things like origins of something and so forth. And the cookie crumbs are really leading to a viral origin. And so in certain cultures, like Asian cultures, there are animal markets where you have an interface between animals like bats and human beings. And these live animal markets are what we think can allow for a virus to, a mutated form of virus to jump from an animal species to a human being. And so there's some kind of a uniqueness there. The other interesting thing about bats is that they actually have one of the strongest immune systems in the animal kingdom. And I'm not a zoologist, so I can't speak to, gory detail about, bat immune systems. But we think that in part, this allows for viruses to kind of get into their system and mutate or change in a way where it doesn't necessarily in other animals and so forth. So bats can almost be an incubator because these viruses need to try to change and modify themselves in a way to try to invade the bat. And in the modifications and the mutations and so forth might lead it to all of a sudden be something that can jump from a bat to a human being and become infective and so forth. So we think bats can be incubators for disease. So other strange things about COVID, look at society right now. When I drive around San Diego, the traffic is a small fraction of what we would normally see because of our attempts to try to prevent the virus from spreading from person to person and affecting a large portion of our population, as well as overwhelming our hospital systems. So, you've heard the terminology flattening the curve, which, with some time we've been able to do to some degree and not overwhelm hospital systems. We've done pretty good down here in Southern California. So, big kudos to our frontline workers in our emergency rooms and urgent care folks. Other states have had more difficulty and so forth, but the whole purpose of flattening the curve was really to make sure that our hospital system, wasn't being overwhelmed with too many patients that needed things like ventilators, because while the early stages of this was happening, this virus was raging in Italy at the time, and it was totally overwhelming their hospital system. So you had some people in the intensive care unit on a ventilator, but then you had people in the emergency room and in hallways who needed, ventilators and so forth, and didn't have access to them because the beds were taken up by other people and the ventilators were taken up by other people. And so we didn't want, we were trying to avoid that from happening. So one of the ways to prevent them from happening is try to prevent the spread of it. So that way, it's more of a trickle that comes into the emergency room. That allows for people who are very, very sick and need, intensive care to be able to get that intensive care and prevent people from having to wait in, an emergency room and so forth, which cannot provide the kind of care that an intensive care unit could. And so that's what we were trying to do with flattening the curve. It wasn't really meant to, it wasn't really meant as a way to prevent people from getting it to some degree. people are still going to get COVID-19, unfortunately, and social distancing will definitely help, but it's still going to be out there spreading. Other kind of strange symptoms with COVID-19, which kind of make it a really unique experience, is some of the symptoms. So some of them are really common. So things like cough and things like body aches and fever and so forth are pretty common with a lot of viral infections. But other symptoms like anosmia, which is loss of your sense of smell, right? That's a more peculiar symptom. We do see it with some viral conditions, but it's not the most common. Loss of sense of taste was another symptom that we see with some COVID-19 patients. We've seen some clotting conditions with COVID-19, where even people in their 30s and 40s have had strokes and so forth from COVID-19. And then we've seen some interesting conditions with some kids, where we've seen petechiae and some blood vessels, in the skin, essentially. So definitely some strange symptomology with COVID-19 makes it very different than a lot of other viruses and so forth. So it's kind of impacted a lot of aspects. It's kind of interesting or strange origins. The effects it's had on our society has been, most people have never experienced anything like this before. So it's very a new phenomenon for most people in the social aspect of things. And even some of the symptomology has been very interesting and unique. So it's been a very peculiar virus kind of across the board. All right, so this is the kind of charts that we look at as scientists and as clinicians and so forth. I only put this up there to highlight some things. Who is COVID-19 going after? And so we use data like this to tell us who COVID-19 is affecting. And all that you have to kind of see with this is, what are the little peaks that stick out on this side, and what are the little peaks that stick out on this side? And essentially, you can see that young age sticks out as a protective factor on this side, and older age sticks out as a risk factor on this side. And that's precisely what we have seen with who COVID-19 is affecting. We see much more severe cases in elderly patients, and the older each decade that goes by from the 60s onward, there's a higher risk of mortality or very severe, cases of COVID-19. So that's the one I think that we're probably all familiar with. And we're going to, again, spend the rest of the time with this presentation talking a bit about that. But while we're here, let's take a look at some of the other risk factors that we see. So over age 65, hematologic malignancy. So hematologic malignancy is just a really big way of saying blood cancer, right? And so people who have blood cancers are much more likely to die or be severely affected by COVID-19. And that's probably because, one, when you get into blood cancers, you are inherently affecting the immune system, because that's the origin of blood cancers. And it's probably severe immune suppression that is causing these folks to be particularly susceptible. Organ transplants. So I mentioned organ transplants before, with the body's ability to take new organs in, and how we deal with preventing the body from rejecting them and so forth. But these folks are at very high risk of having a serious either death or serious version of COVID-19. This one's kind of interesting. Neurological conditions other than stroke and dementia, which have its own category, which is down here. And so this would be things like Parkinson's disease, Lou Gehrig's disease, multiple sclerosis, and so forth, other neurologic conditions. It's not clear why that is, but we're seeing that. Diabetes. So diabetes is up here. It sticks out over here. So uncontrolled diabetes has a tremendous amount of kind of bad effects across the board: cardiovascular system, kidney functioning, etc. But it also seems to make us more susceptible to COVID-19. So infections is a problem with folks with diabetes as well. And obesity, a very prevalent condition across the board. And obesity is right up, or is it right up here, kind of sticking out right up here. So nowhere near as much as aging, of course, but still something that certainly peaks up over here. And again, 18 to 39, that is such a protective age group that they don't even have a little plot for it. It's not even on this graph right here. It'd be somewhere over here. That's how protective that would be. All right, so it gives us an idea. So data like this gives us an idea of who we have to be really thinking about in terms of targeting, both with our public health responses and with our patient care. So let's talk a bit about the immune system now. So over here you see a gentleman that you might be familiar with, who is kind of aging right before our eyes, right? And so we all know what aging looks like. We see, you know, these patterns in skin. We see the patterns in the musculoskeletal system with some of the loss of the subcutaneous fat and the loss of muscle over time. And so we know we have this kind of picture in our mind that you know, aging produces a thinner person. Generally speaking, aging produces a person that has problems with mobility because it affects the joints and musculoskeletal system. It affects the skin with increased wrinkling and sunspots and so forth. So we know what aging looks like, right? We work with people and live with people who are in various age groups and so on, and it looks like. But what does it look like on a biological component? So we're going to be diving a bit into that. The first terminology I'm going to start off with here is something called immunosenescence, which is kind of a big word, but the first section is immune and the second section is senescence. And so basically what this means is as we age, as cells age, they stop dividing at some point. And these cells will undergo what we call a programmed self-death. So they're already pre-programmed to at some point basically commit suicide, if you will, and to kill itself off so that other cells, healthy younger cells, can come in and do its job. So cells are designed to have a timeline, and then they kind of get rid of themselves and so forth. And immunosenescence is basically when we are, these cells that are supposed to be, you know, programming itself to die are not, right? And so these senescent cells can build up in the immune system where they're no longer young and dividing and doing their job effectively. And that's one issue. The other issue with these is that they make the cells around them who are young and healthy and doing their job effectively sick. So it's almost like, you know, we use the term zombie cells to kind of as an analogy for immunosenescence. And the reason is with zombies, right? They go off and they attack somebody who's healthy and they turn that person into a zombie, right? So these senescent cells are sending chemicals out to the healthy cells, and the healthy cells are becoming sick like the senescent cells. And so you have a dual impact. You have these old cells that are piling up and making the young cells sick. And that is immunosenescence, and that is a big problem of aging, and across the board, not just with the immune system. And right now, scientists are working on ways that we can potentially combat this, but it's very early. This is still early development with how to approach immunosenescence, although there are some interesting things coming off of that. Another term you might hear is a term called inflammaging, right? And basically, they're combining two words, inflammation and aging. And part of this immunosenescence is the creation of a tremendous amount of inflammation in the body. And that is, again, part of those chemicals that are coming off and making the healthy cells sick. All right, production failure. So we talked before about where the immune system starts in our bone marrow, right? And so part of the reason why we start to see the immune system not work as effectively is because you start to have some issues with production. If you are not producing the same number of cells, the same quantity of B cells and T cells and so forth, you're not going to have the same robustness in the immune system to take care of an infection. Sometimes there's the same number, but the quality of the actual cell is different in somebody who is 65 plus versus somebody who's, say, 40. And so you've got both a quantity and a quality issue with this production coming out of bone marrow, okay? And it can happen both in the bone marrow, and it also can happen in the peripheral tissues with the thymus gland and the lymph nodes and the spleen and so forth. I didn't mention the spleen before, but that is also part of the immune system. All right, so quality and quantity, you mentioned that, okay. A good example of this, kind of a real world example of this where you might see this kind of play out is with the flu vaccine. So, each year, we public health officials and clinicians will, ask patients to go get an influenza vaccine, largely to protect the most vulnerable populations, the old and the young. And we give people over the age of 65 a different dose of the influenza vaccine. I wonder why that is. Well, we found that when we give the normal dose of the flu vaccine to somebody 65 plus, their system doesn't respond to it the same way. It doesn't create antibodies in the same quantity as somebody who was, say, 30. And so you don't get the desired outcome with a standard flu vaccine. And what you're doing with the vaccine is you're giving these little pieces of the flu itself, these little protein pieces that we call antigens. And so we create this high dose flu vaccine that has double or triple or quadruple the amount of antigens in it. And that's the only way that we can get somebody who is older to respond with the normal production or near normal production of antibodies, so that they can have a built-up reservoir against flu. So that's kind of a real-world example of how we already see the quality and quantity of antibody production as being very different in older populations than in young populations. All right, thymus involution. So we talked about the thymus sitting underneath the sternum, kind of up here, right below that notch in the throat. And so thymus involution is basically when the thymus atrophies or gets smaller. You lose healthy thymus tissue as you age. In fact, the thymus can shrink to be completely gone and have no functional thymus tissue. Or it can shrink to a point where it has just very little thymus tissue. But as you age, and each decade goes along, you are losing this valuable immune organ that can't take T cells and make them these mature, robust warrior cells that we need to defend ourselves against microbes. And so the thymus involution is a huge problem. The other interesting thing is with thymus that we aren't really sure about, aside from the actual gland kind of shrinking over time, is the thymus is actually being infiltrated with fat. And we don't really know why this happens, but these adipocytes, these fat cells, will go in and take up the space where the healthy thymus cells used to be. So when we look at them under an MRI or something, we see this fat tissue that wasn't there when they were younger. It's possible, we don't really know yet. One of the theories is that maybe the fat cells are playing a role when they come in for whatever reason and kind of set up shop there, that they're making or cascading more damage to the healthy thymus cells, and we're losing more. But again, it's too early. We don't really know for sure what the function, or if the adipocytes are causing more problems or not. And the last couple here are genetic mutations and epigenetic changes. So as we live and grow older, we accumulate mutations. It's kind of a normal part of the process of being alive, because we're exposed to things like UV light, and we're exposed to air pollution and chemicals in our food and in our water and so forth. And then also just as kind of the normal process of creating new cells, mistakes can happen. And so we do accumulate genetic mutations as we age, and this can play a role in producing cancer. It can play a role in producing ineffective cells and so forth. And then epigenetic changes they're similar, but they're not exactly the same. Basically, epigenetic changes is genes function as on and off switches. They make things, right? And so epigenetic changes isn't necessarily changing the code, isn't changing the DNA strands and so forth, but it's changing the way they behave, whether they're turned on or off. And so, again, our environment and our exposures and our lifestyle plays a role in turning on or off genes, and that can have pretty large consequences on the health and the youthfulness of our immune system, as well as other tissues. So, we think that all of these things here are playing a role in the decline of our immune system as we age. And this decline clearly is playing out with COVID-19 death rates, as well as severe cases in the older populations. All right, another just pictorial here, because kind of showing you this kind of process and how cells will change, B cells and T cells will change with the immune system. The little pieces of data in it are not so important. It's just kind of something to show you how things will tip into an inflammatory environment as the aging process occurs. So we have some information now about what's going on, what is causing the immune system to age and not function normally, and then our susceptibility to disease states. So what can we do at this point, right? And so this is, again, where I remind people that this is not a prescription for a DIY project, right? Anything that is mentioned here is for informational purposes. I am not treating you with any or recommending any treatments to anybody. But there is information out there, and there is credible information out there from credible sources. And so one of the places that I go to is Oregon State University. They have an institution called the Linus Pauling Institute, named after the famous scientist Linus Pauling, who's now deceased. And they produce an enormous amount of nutritional information, nutritional data. That's fantastic. They do due diligence, and I can't give them, the researchers up there, enough credit for what they produce. And so they actually produced an article about the immune system and COVID-19. And the 4 things that they suggested or thought were the most important to increase during the COVID-19 pandemic that we're currently in were these 3 here: vitamin C, vitamin D, zinc, and DHA, which is a component of fish oil. So we get DHA from fish when we eat fish. And so these are 4 of the most crucial in this environment where we want to enhance the immune system. These are not treatments for COVID-19. These are useful for making the immune system more robust. There is some interesting data that has come out in vitamin D. When they look at populations that have been affected, people who have actually had COVID-19, and they look at blood markers, what they did is they looked at vitamin D levels, and they found that people who had vitamin D levels who were deficient in the lowest quartile were much more likely to have a bad outcome, so a death or very severe case of COVID-19. And when they compared that, and that's as compared to the people who had higher levels of vitamin D who also had COVID-19, they seem to have better outcomes. So this is observational data. This is kind of epidemiological data. And so we can't prove cause and effect from it, but the finding was very interesting. And so I encourage everybody to have their vitamin D tested across the board as just routine practice, but also in the context of right now. And then, talk to your clinician about whether this is what makes sense for you as an individual and so forth. There is ongoing research, and you may have seen things about IV vitamin C. And this is still very, very early, but they are using it, or studying it, I should say, in the ICU units, so the critical care, intensive care units and so forth, to see if it can blunt the cytokine storm that occurs with COVID-19. So the cytokine storm is kind of like it's kind of like the perfect storm. The immune system is doing its job to try to fight off the virus, but it's doing a lot of damage to the lungs, and essentially it's causing the lungs to go into respiratory distress and potentially failure. And so they're doing everything they can, and studying things to see if they can't find ways to prevent these folks who do get it so for treatments. And so one of the treatments they're looking at specifically for the cytokine storm is to see if they IV vitamin C at the ICU units, if this will have an effect on outcomes. And too early to tell, just simply mentioning that they are studying it. We don't really know yet. And then, my little marker here. We've got vitamin D. We mentioned that again. That came out of Northwestern University. It was a study that was produced, I think, about a month or so ago, maybe a little. And we mentioned that already as well. All right. Next slide. All right. So that's a bit about the nutrition data and so forth. And now we're going to talk a little bit about what's coming down the pipeline to be used for rejuvenating and making the immune system as young as possible and as healthy and youthful as possible. And so there's been an interesting study came out in 2019 by a researcher named Greg Fahey, as well as a number of other folks that were on the paper, including Steve Horvath, who's another kind of famous researcher for studying aging clocks. And so this study used growth hormone and was evaluating what growth hormone did to the thymus gland. And this was actually coming off animal studies. So there's a bunch of animal studies that have also looked at the effect of growth hormone on thymus gland. And there was a study done quite a while ago on HIV positive patients because they have issues with the immune system. as part of the viral infection, and were able to show some positive responses to growth hormone in the context of HIV. And so this study was long overdue, but thankfully it was done. Interestingly enough, I'll talk about the immune system first, but they showed an increase in the thymic mass, and they were able to do that because they looked before and after with an MRI, as well as thymic density. And then they showed a decrease in the thymic fat-free fraction, right? So this is the amount of fat that's sitting in the thymus gland. And so there was a decrease there. I realize the way I wrote it could be misread because of increase here, but there was less fat in it. And there's also an increase in the CD4 T cells, which is a very important part of the immune system. And so that was really interesting and really encouraging, and kind of fed off of the animal studies and the study done in the past with HIV. What they did not expect is that it actually moved the needle on the aging clocks. And so they did the aging clocks on people, and then they did it 1 year out and 2 years out. And they I believe it was 1 year out. And they found that there was approximately, at least specifically with this GRIM age clock, there was a 2-year improvement, meaning their biological age was 2 years younger than when they started. Obviously, their chronological age, they were a year older, but biologically, looking at this epigenetic clock, they were actually younger because of the growth hormone. And the growth hormone was used in conjunction with 2 other agents. One was DHEA, which is a hormone, it's an androgen. And the other one was metformin, which is a drug used for many things, but most well known is with diabetes. And this is because growth hormone can actually increase blood sugar, and that's a harmful effect from growth hormone. And so the other agents were used to blunt the elevations in glucose levels, which they were able to do just fine. So this was a really big breakthrough from last year, and the hope is that there's going to be more coming. They're going to do further studies because it was a very small study. It needs to be repeated with a larger group of people. But these people were healthy on growth hormone through a year. They didn't have any signs of growth hormone causing cancer or making the prostate grow, which was a concern as well for men. So a lot more to come here, but a really exciting piece. Now, I just want to mention that growth hormone is only allowed in the United States to be used on label for growth hormone deficiency, which not a lot of people have. And so it is one of the few drugs, if not the only drug, that is actually illegal to use off-label. Most other drugs can be used off-label for other conditions. Growth hormone is not allowed to be used off-label for whatever reason. That's a regulatory issue, that hurdle that we'll have to overcome in the future if the research keeps going in this direction. So here's another one here. This one is, we call the category as a TORC1 inhibitor. The experimental drug is called R2B10. Not super important. It's a drug in development currently by Restore Bio, and I have no affiliation with Restore Bio. I just find what they're doing very interesting. And so here's what they've seen. So they got interested in this because they were able to show, and not just them, but other people in animal studies, that it made animals live longer, right? And so when you make animals live longer, people are very interested in something to see if it could potentially apply to humans, of course. And the interesting thing is the way it interacts with the body is on a conserved piece of biology, meaning that the way it interacts exists in things like fruit flies and worms and mice. It also exists in human beings. And so it's encouraging to see it work across organisms in animal studies. And because the biology is consistent into human beings, the hope is it will also help extend human lifespan or be used for disease processes. And so when they studied it in the context of infections, they were able to show an improved antibody response in human beings. They were able to show a 42% reduction in upper respiratory infections and a 30.6% reduction in lab-confirmed respiratory infections. The effect was greater with the more severe patients, and when they compared it to Tamiflu, there was about a 5-day reduction in time to alleviation in the moderate to severe symptoms, whereas Tamiflu, there was only a 1-day reduction. So it seemed to have a better effect on relieving symptoms than Tamiflu, which is already on the market. And so this is really interesting research. It is not yet FDA approved. And this is just one example of many things that are in this category of hope for the immune system, hope for the aging process, and age-related disease as things progress. But we are hoping these will be, their studies will continue to show benefit and will get approval. So this is a non-drug, but this is another kind of concept, the concept of calorie restriction. And so what we find in studies where we can restrict calories, which largely we do with animals, it's hard to do that with people. They were able to delay the senescence of T cells, which is that process where they kind of turn into the zombie cells. And we're able to stimulate T cell maturation in the thymus, so enhance those young, immature recruits into these mature soldiers, right? So they were able to make that a better process, and they think it also may be increasing growth hormone, which perhaps calorie restriction via growth hormone increase is actually causing these changes, which would correlate with the study we just showed you here with the growth hormones there. So, so interesting information. It's all animal studies for the most part so far. The calorie restriction is very hard to do with people. Calorie restriction doesn't feel good. We have this desire to eat, to fulfill ourselves. And when you're living for any extended period of time on a very low calorie diet, it's not very comfortable. So it's very hard to get people to actually do this. But what they can do is they can prove concept based on calorie restriction, and then they can look for agents that they can use for calorie restriction mimetics or mimics of calorie restriction as part of a drug or an herb or a supplement or any sort of vehicle. And there is a long list of calorie restriction mimetics that are currently being studied. So another kind of interesting area of research and some hope for, rejuvenating our immune system. And the last kind of piece here is kind of the pragmatic approach. This is some of this recommendations from the CDC, WHO. We put a few extra in here that we think are just, make sense and so forth. First off, if possible, don't give your enemy, in this case the microbes, an opportunity, right? Don't put yourself in the line of fire. That's one of the easiest ways not to get sick. Avoid sick people. Social distance at least 6 feet apart. There have been some studies that show that when we talk and we laugh and we eat and just our normal, human interactions with people, we launch little particles of mucus and spit and saliva and so forth much further than 6 feet. Things that we don't really want to think about, but it's important to know that 6 feet is a minimum. If you can, distance yourself more from groups of people that you are not related to, that's not a bad thing. You're less likely to launch something at your neighbor and have a virus in it. Changing clothes and showering after being with a group of people. And again, what we're looking at there is, did somebody cough and kind of launch virus that landed onto your skin, and then later on you touch your skin and now touch your face, and then maybe you rub your eyes or something like that. And so, the shower concept and changing your clothes is just removing the chance that virus got on your kind of outer layer, whether it be clothes or it be your skin. And so again, that can't hurt. It's not part of any official CDC or WHO recommendation, but I think it makes sense. Exercise. There is some really interesting research that shows that when we exercise after we get a vaccination, we actually get an increase in antibody production. So the exercise actually seems to potentiate the vaccination. And so certainly, if in that scenario, if we want to exercise to enhance our immune system as much as possible. Vaccinations, there is no COVID-19 vaccination right now. The hope is there will be one eventually, but we're not talking about anytime soon. This is going to be quite a while before we have vaccinations that have been vetted and make sure they're safe and so forth, and work, of course. Healthy diet. We already talked a bit before about interactions between dietary components and infections and COVID-19. It makes sense that if we're eating a healthy diet, you are giving yourself the core ingredients that the immune system will use to produce antibodies and T cells and B cells and macrophages and so forth. So think of it as the raw materials for your immune system. You got to make sure you're having enough of a lot of different agents, and don't put junk in it, essentially, which isn't going to help with the production and could potentially cause things like inflammation and maybe hamper the immune system. Sleep. We know sleep deprivation can put people at risk for a variety of health conditions. It is super important to the immune system. So sleep is another really important one. Get at least your 8 hours. If you can take this time to really, get some additional sleep, it's going to work across the board for a lot of concerns, but certainly will help the immune system as well. Wear your masks. Masks are not designed to help to prevent you, from getting COVID-19. Most of these masks are not at a grade that will actually prevent these particles from coming in. What you're trying to do with mask wearing is anytime you are in proximity to someone who you are related to, or even if you are related to the person, it allows you to, catch little particles that you might, mistakenly spit out and so forth. So the mask is designed to catch things that you are producing, and then potentially help the spread of the virus and so forth. So that's the purpose of the masks. And so that is the conclusion of my presentation. It is by no means comprehensive. There are so many different areas and things that I could have included, but hopefully we made a case for the effect of COVID on the virus, COVID-19 on and the interplay with the immune system and aging and so forth. If people have questions, I'm happy. You can go ahead and unmute yourself, and I'm happy to take any sort of questions. I can't give medical advice, but I'm happy to take questions. Stop recording.